Joe Ingles is feared to have suffered a significant knee injury on this play, and in this video, we're going to take a closer look at exactly what happened. Welcome back, everybody. I'm Dr. Brian Sutterer. Now, Joe Ingles here, as he was cutting into the basket, suffered a pretty bad-looking left knee injury, and the initial concern that a lot of people had looking at this, because you guys have seen enough videos like this by now, is for an ACL tear. And I think that's definitely on the differential here, but there's a couple other things that I'd be concerned about as well. First of all, in regard to the possibility of an ACL tear, this is the classic position, classic mechanism for when we see these non-contact ACL tears. As Ingles plants with that left foot, right as he steps, you get this sudden ground reaction force that transmits this load up through his body. You develop this moment where the knee wants to come inward as the tibia is kind of rotating relative to the femur, and you get this kind of torque that twists that knee inward and forward. Also remember that the ACL is preventing the tibia or the shin bone from shifting forward relative to the thigh bone or the femur. So whenever the ACL is torn, what we can sometimes observe is actually that tibia shifting forward relative to the femur because of that insufficient ACL. Now here, when Ingles goes down, you can actually see what looks like that tibia kind of shifting forward with this abnormal contour we're seeing right here of the leg. So if we wind this up, you can see it's just the moment before he plants, everything looks nice and smooth in the front of the knee, the heel lands, and all of a sudden, boom, right there, you get that kind of contour that looks like it could be that tibia translating forward. Now here in this position, you can also actually make out a little bit of what looks to be the patellar tendon being stretched as that tibia shifts forward, because again, the patellar tendon is running from the kneecap down onto the tibia. So certainly an ACL is on the differential here, as is everything that can come with an ACL tear, like an MCL tear, meniscus or cartilage injury. You have to remember that these are a spectrum of severity. But there's one part of this that doesn't really fit and makes me wonder about the possibility of something else, like maybe a dislocation of his kneecap. First of all, while an injury like an ACL tear is going to be painful, it typically is not as painful as we saw Ingles reacting here, especially in this moment where it looks like one of the medical staff is basically trying to straighten out his knee. You can see Ingles really audibly react to that position of him having his knee extended. Playing that back through one more time here, we can see the medical staff going to straighten that knee and how much Ingles reacts before suddenly sort of feeling like something kind of went back or gave way. This is the maneuver that we would do if we were trying to reduce somebody's kneecap that had shifted out of place. Basically, you take the knee from a flexed position gradually into a straight position while you push the kneecap back in place, and it can be extremely painful. But that's the first thing I thought of when I saw this specific maneuver performed on the court. There's also a lot of overlap between the mechanisms of an ACL tear and the mechanism of when the kneecap dislocates, because typically when the kneecap dislocates, it pops out lateral or to the outside of the knee because of it being pulled laterally when the knee caves inward. So here in this position, of course, Ingles' knee falls inward, which is going to strain the ligaments that are helping to keep that kneecap in place. And then as the play continues here, you can almost make out a little bit of a contour in the front of the knee that if you just go a couple frames further, suddenly disappears. So I wonder about the possibility of a kneecap dislocation occurring kind of in the sequence of what happened after the initial injury. So we'll see what the final word is here. I think it's important to be able to recognize some of these patterns, but also understand kind of when everything doesn't 100% fit. So yes, that initial foot planting on the left side, that stop, does correlate with the mechanism of an ACL tear and everything that we subsequently see, but the level of pain, that reaction when his leg was being straightened out, to me suggests there could be something additional beyond just our standard ligament injuries that we hear about with the knee. The good news is that they're letting him fly back to Salt Lake City, so we're not concerned about like a knee dislocation or really traumatic fracture, something that would need immediate evaluation there at the hospital locally. So that's at least one reassuring part of this whole story. That's it for the video, everybody. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.